Hi, my name's Matt Stonestreet. I'm one of the orthopedic total joint specialists at OrthoUnited. I grew up in the Youngstown area. I went to McDonald High School and then went to Youngstown State University. After that, I went to what is now NeoMed, I believe. It was Neo-UCOM at the time. And then I did my residency at Akron General for 5 years there. I did 1 year of fellowship training at the Core Institute in Phoenix. After that, I came back to the Youngstown area. Initially, I was in practice there at Sharon Regional Hospital for about 5 years and joined the Omni side of OrthoUnited 7 years ago in 2018, and I've been here ever since. At OrthoUnited, with my specialty being total hip and total knee reconstruction and replacement, I see primarily people over the age of 30 to 40, as arthritis is typically a degenerative condition, so I'm not seeing as many athletes these days. So I see people anywhere from their mid to late 30s to their 90s, and once again focus on both primary hip and knee replacement as well as complex primary hip and knee replacement and revision of already replaced knees and hips. At OrthoUnited, I think what makes us special both as a practice and as individual surgeons is kind of like what makes Stark County special. You know, we've all done advanced training and learned all the new techniques, but brought it back home to take care of the people in our community. And I think that's what makes us special. We're not trying to bring anybody out. We really make it a point to get to know our patients. I'm lucky enough in a hip and knee replacement scenario that I get to see people quite a bit. It's not often that I'm operating on that patient the first time I see them. We're usually giving them injections and trying physical therapy and other things first to see if we can get them feeling better. So it allows us to really get to know people, and I think that is what sets us apart, is that we treat people like their friends and family, and we want them to feel that way with us and also stay in our community and provide that care. I also think that in a private practice scenario, as opposed to a large hospital conglomerate, we are able to really provide the most efficient and highest quality of care. In the surgery center, I think that allows us to really streamline your care. So we're taking things that are often done in hospital settings that may take a lot longer and require overnight stays to really a very efficient and streamlined episode of care in which you're getting your total hip or your total knee replaced at a orthopedic specialized surgery center, and you're able to get up and move with nurses and staff that see this case thousands of times a year, so they're very familiar with that, and we're able to optimize your care during that episode, but also your outcome at the end of that. At OrthoUnited, we truly like to focus on keeping expert care in our community, and we do this by bringing in the newest technologies such as robotics and minimally invasive techniques, and we provide these techniques at orthopedic specific surgery centers that allow us to do these thousands of times a year and really provide truly specialized care throughout the episode, and that includes preoperative, intraoperative, and postoperative care where you get truly specialized nursing care throughout. At OrthoUnited, we specialize in all aspects of orthopedic care. Every ache and pain does not always lead to a surgery, and any information is going to truly help you in your care, whether that be activities you can change, exercises you can do at home, medications, injections, and surgery always being the last option when conservative management fails. Part of what we enjoy at OrthoUnited and why we do what we do is to make patients feel better and to truly change their quality of life. I'm lucky enough in a hip and knee replacement scenario to really see that daily. I have patients that send me pictures after they've completed hikes that they were unable to complete beforehand. I had a patient who was a unicyclist and had severe hip arthritis and was unable to ride the unicycle, and we were able to get him back to doing the things that he loved after hip replacements. And once again, to me, the most important part of that is really seeing the change in a patient's quality of life and how happy they can become after debilitating pain for many years. We like to say that a lifetime of mobility starts at OrthoUnited, and I believe that's true because we are able to truly cover every aspect of orthopedic care, from sports medicine and younger athletes to that weekend warrior, every extremity. We have fellowship trained physicians and really able to keep you active from your teens and 20s all the way up into your 80s and 90s.